Hi, this is Dr. Christy DeSaffrey, founding physician of Bone and Body Women's Health. Today I wanted to talk about hormone therapy, particularly because many of my patients who start either estrogen or progestogen therapy or combination if you have a uterus have questions about potential side effects. How long is this going to take to make me feel better? So these are common questions that we get that we really have some good answers to. So let's review them. Many times when we start oral or transdermal estrogens plus progestogens if you have a uterus, very many common symptoms are things like breast tenderness, bloating. Sometimes people have some spotting or vaginal bleeding. Other times people feel like a little revved up or some anxiety before those medicines kick in and help our hypothalamus, help in the brain, help with the ovarian stimulation that we're trying to achieve. So when we think about, and obviously treat the symptoms that we're trying to prescribe for as well. So these are very common. So things like breast tenderness, obviously this feels kind of funny, particularly because many women remember breast tenderness possibly from taking birth control pills in their 20s or from being pregnant or nursing, but this generally goes away within 1 to 2 weeks and generally is around the area of the nipple or the external part of the breast. What I tell my patients for this is that, we can use soft fitting bras, making sure that if you are doing exercise, that you are using a actually tighter fitting bra, so you're making sure that you are helping the breast sort of stay in place. This generally, again, goes away. If you have a lot of caffeine, we know that this can stimulate the breast tissue too, so sometimes backing off on the caffeine can help. What about bloating? So again, this symptom similar to breast tenderness might be that there's a surge of estrogen in an otherwise estrogen deficient state that you've been in the perimenopause or menopause. And so this generally goes away too. And actually women on hormones tend to be leaner, tend to have less abdominal adiposity or visceral adipose tissue and have more skeletal mass. So sometimes this just takes a little bit of an adjustment. In terms of bleeding or spotting, we obviously never want to start any hormones, including birth control pills or hormone therapy, on anyone who has abnormal uterine bleeding, spotting that we don't understand where that's coming from. So could this be vaginal, uterine bleeding? Could this be a polyp? Could this be just due to hormones or a thyroid condition? So we always want to make sure that we understand the bleeding pattern and how that is changed or different, or if this is typical or atypical before we start any hormone therapy. But again, when we're making hormones and we're changing the hormone sort of distribution and adding back some hormones, the difference of estrogen plus progestogen sometimes can cause some bleeding or spotting. Some of this is cramping, some of this can be darker or spotting, and people can notice that if they skip hormone pills like a progesterone, or they don't change a patch or take a pill in the same time. So generally getting into a pattern of taking these is important. We can have bleeding or spotting for up to 3 to 6 months. So anything beyond that, we always want to evaluate, or obviously if the bleeding pattern is very bothersome. So that's really the main symptoms that we think about when we're starting hormone therapy, if you are the right candidate for that, thinking of breast tenderness, bleeding, bloating, and these are things that we can generally circumvent and work beyond to maintain being on hormone therapy if we think this is the best option for you. Hope to see you soon.